Hey guys, my name is Michael Riley. I'm here to do this presentation for the Community Needs Assessment. My introduction is basically stating that police officers should respond less to welfare checks. People with suicidal thoughts, that involves with no threats to harm or others or weapons present, and people with mental health disabilities in crisis. The targeted population, particularly homeless and or people with mental health disabilities, are often having police respond to them instead of a social worker and or a crisis response team. Having police officers respond to such incidents are less likely to improve the crisis. There are 2 interviews conducted involving people who have a powerful role in the mental health crisis response field in Maricopa County, who will provide insightful information on how it is conducted in Maricopa County. First person was in person with Detective Stamps, who is a crisis intervention team program coordinator with the Mesa PD. She has extensive college background, including a master's in counseling and human relations. She's taught mental illness for the city for 17 plus years. The next person was an over the phone interview with Matthew Moody, who's a director of operations of Solari Incorporated, previously known as the Crisis Response Network. He's worked in the mental health for 12 years and currently oversees the crisis line in Maricopa County. So what I found is there's over 1 million 911 calls in Maricopa County. Possibly 1/3 are mental health related. Mesa alone is averaging 10 suicide calls a day, with a 14% increase for the last 5 years. 1 in 4 police shootings involve people with mental health. Average 7.9 American adults with severe mental illness in this country, with 1 in 10 of all law enforcement responses are involved with a person with mental health. When the crisis line was implemented with Mesa PD dispatch, an average of 100 calls a month were transferred to the crisis line. So what are our options? Well, we got several. Option 1, we have the Maricopa County crisis line. They accept calls regarding mental health. They can provide services over the phone. They can provide mobile crisis teams to respond on scene if needed. The majority, I think 70% of the calls are taken care of over the phone without any need to respond in person. There's emergency mental health institutions like Community Bridges or UPC, which are more like a 24-hour emergency situation, and then the patient's released the following day. There's extended inpatient mental health institutions like Copper Springs or Desert Vista Hospital. And then last but not least, the permanent psych facility like Arizona State Hospital, where a patient may need an extended period of care and may take years. And then, of course, 911, police or fire can respond to the scene. So as far as history goes, it all dates back to 1981, Arnold versus Sarn, which is Arizona Supreme Court, which states that the state requires the provision of community mental health services to all persons with serious mental illness. Required a blueprint for a community mental health system to be created, must comply with SAMHSA standards, must have the following, which is the crisis line available to anyone, crisis mobile teams, and facilities that people can walk into. Right here, you're looking at the sequential intercept model. And what the idea is, we want to prevent mental health subjects on the street from going down this list. We want to intervene level 0, level 1, before they're having to go to court, before they get to jail, parole. If we're able to intervene with the crisis response team, provide them help versus a police responding to the scene and then possibly getting charged with a crime, this could better provide them services in the long run. Going forward, starting in 2022, we're going to have a new number. It's national, 988. People can call this number, and a crisis response specialist will answer the phone and provide services. In 2015, Maricopa County saved $70 million for utilizing crisis response teams. And this is much cheaper than first responders, police, fire, EMS, jail, hospital visits. You know, if these people go through any of that, it costs the county tremendously a lot more money versus, you know, a CR team coming out there. And also having a crisis line specialist responding is the least evasive strategy, right? Police officers, the jail, potential uses of force, they're all traumatic experiences for individuals. Higher chances of escalation when police respond. Maricopa County crisis teams have 30 total teams of 2 with up to 18 teams during peak hours with an average of 34-minute response time. My recommendations would be more funding for the city of Mesa to implement a smaller 24/7 crisis response team for Mesa only. This will create a faster response team and will respond to some crisis situations that Maricopa County will not. An increase in Maricopa County crisis phone specialists and crisis mobile teams, more beds for the Arizona State Hospital for serious mental health subjects, which there are only 75 beds currently for the entire state. Okay. There also needs to be a creation of specialized group home for mental health population, and I'm not talking Alzheimer's. I'm not talking about people with learning disabilities. I'm talking about something else, right? For all the others. I also recommend an effective promotion of the new 988 number to maximize the utilization of the crisis line. Further training with police officers for crisis intervention and mental health. Further training for police dispatchers to recognize 911 calls that are mental health related in order to divert them to the crisis line. My findings, I'll be emailing my results to the 2 subjects I interviewed. And due to Maricopa County being the gold standard regarding mental health crisis responses, according to multiple sources I've looked into, I want to use them to help spread the word to other departments across the country. Most cities do not have a crisis line or mobile teams. I think society needs to change in how they look at mental health. This transition will benefit everyone, the targeted population, police, and the community. The interviews provided a great resource and insight. There was some scheduling conflicts and a hard time getting callbacks, but overall the project was quite a success. All right, guys, thank you so much.